Okay, friends, welcome to the last video of dysmenorrhea chapter. So here we'll have a complete overview of dysmenorrhea. Okay, uh, 1 second. Yes, dysmenorrhea. So I told as classification, it's primary or secondary. Correct. Now in primary, the same expected management and workup which I have explained. Okay. And what are the other things which you can see? This is one classification, and also you can see cyclical pain. Oh, I told you that I will explain about cryptomenorrhea, right? Okay. Cyclical pain. See, what happens in cryptomenorrhea, no? This is the uterus. But problem is there's an outflow tract obstruction. What does it mean? See, she's menstruating, okay? No problem in menstruation. Not at all a problem in ovulation, okay? But there is an outflow tract obstruction so that the blood cannot, come out. So what happens? Pressure starts to build up on pelvis, uterus. Then it translates to the next structure, tubes, ovaries, then to the pelvis. So here you will have cryptomenorrhea comes with a classical dysmenorrhea symptoms. Okay, what will you do? See again, no outflow tract obstruction can be due to imperforate hymen or vaginal agenesis, all those things. This I think I will touch upon in primary amenorrhea than dysmenorrhea. Okay, dysmenorrhea is something which you should know as such in general, what treatments, what diseases are there. So I'm just touching upon that. Then again you add something called as premenstrual syndrome, where she came with pain after ovulation, that is second half of cycle. Then how can we forget the first video, that is ovarian dysmenorrhea? Correct, no? Yeah. Then again there's something called as PMSD, which is again something to do with psychiatry, which I didn't touch upon. Correct. So these are the things. And also in pelvic congestion, whether we talked about that premenstrual, yeah, no, again what happens is, see, there is a vein. Okay, I know I should draw in blue. Okay, see what happens due to congestion over here, and also the valves here will become loose, relax. So what happens? There is congestion over this part. What will this do? Press the structures. What structures? Might be nerves, arteries, vessel. If it presses nerves, what will have? Pain. So what do you think is the best investigation to treat this? Huh? Yes, artery vein. What do you think? Doppler. Yes, correct. So if it's more than or equal to 6 mm, then it can be a case of pelvic congestion. Okay, that is one thing which I need to touch upon. Then other diseases, you have ovulatory pain. Correct. I think with this, so how many diseases which we saw? One. Let me highlight it so that you remember for a longer time. One. Secondary, again you will have a lot of other things, adenomyosis, CSRS, which we will discuss in subsequent classes. 2. Okay. 3, 4, 5, 6. So 6 diseases related to dysmenorrhea, something which we discussed. Correct, no? Yeah. So does it have a pattern? Yes, treatment pattern is same. What advice which we discussed in second video, that is non-pharmacological. Then in pharmacological, either you will have non-hormonal or hormonal, based on age and based on age and the patient, tailoring of the specific medications has to be done. Non-hormonal, usually NSAIDs, usually mefenamic acid is given. Okay. Usually they will sort out. So here only in this case you have to refer to psychiatry, because that's something out of OBGYN. Actually it's fine, but for completion's sake I'm just saying that. So you remember this is something which is important. Then workup, which we have discussed in the second video. then premenstrual syndrome, then ovarian dysmenorrhea, just have an idea. There is something like this. So when you are sitting in a primary healthcare setup, you just don't. I know 95% of the patient is something who comes with the same thing. Speaking with respect to statistics, you are 95% right. But what about 5%? Just have this concept back on your mind. I think with that, dysmenorrhea as such, in an approach, how we go that and that physiopatho and also history, investigations, treatment, I think we have dealt with in a proper way. I think with that, I think we have covered dysmenorrhea. Next topic of us will be amenorrhea. Okay, till then, take care. Bye bye.